Hi guys, welcome back to OSCEs TV. On this episode, we are going to learn on how to administer mixture medication. So stick and stay with me and let's learn together. So in mixture administration, these are the things that you need. You need your treatment sheet, the patient treatment sheet. You need your drinking cup. This is our medication. Then you need your bottle of water. You need the saucer with your spoon. Then you also have the measuring cup. Yeah. So before that, you need to first establish rapport with the patient. You need to identify the right patient, the right dose, the right medication, the right time for administering the medication. So this is my patient, Miss Augustina. She is going to be our patient today, so I need to explain the procedure to her and also make sure that she understands everything that I'm going to do for her. Yeah. So, Sister Oge, Pacho, good morning. Pacho, how are you doing today? Okay, my name is Nurse Amo. I'm your nurse for this morning. I'll be the one to send your medication, check your vitals and all that stuff. So it's time for your morning medication, which is an oral medication I'm going to give to you. So I want to come for permission before I administer. You have the right to also reject your medication, but I will advise if you take the medication because it has more benefits for you. It's going to help you with your treatment and other. So am I permitted to anyway?
Yes.
Okay, thank you. So guys, after one thing that we normally ignore is by letting the patient understand that he or she has the right to reject the medication. It's one of the major things that we need to understand, because when you check the procedure manual and stuff, you see that the patient need to explain to the patient the need for him or her to reject the medication, but you need to let the patient know the benefit and also encourage the patient to take the medication. So now, Ms. Oge has given us the go ahead to bring our medication. Okay, so before we serve our medication, we need to do checks. So I did my first check with a PC before I walked to Madam Oge. So here too, I need to check the medication, compare with the one on the treatment sheet. Then also check the time I'm supposed to give the medication. Okay. So after you are done checking, you need to also shake the medication gently. So you see the way I'm holding it, like this. Then you do it like this. Then you put it down. Then you pick this one too. Then like this. So that's how you're going to do it. So you need to also, after I'm done gently shaking the medication now, I need to also, this is my babe, an improvised one. So you see the measuring cup on this one, it has some calibrations. So you know the amount that you are supposed to give to the patient. So you compare with the one on the treatment sheet. So so before we give the medication, we are going to put a babe on the patient's neck so that we won't spill the medication, or if there is any spillage or anything in the patient. Sister, okay, if I show me the way I shall also crack. I said, be a drone, a being cushion, Story about your opposite tenacity and answer opposite. So you need to ask the patient the comfortable position of person or then you do so. So So let me do it for them. Okay. So guys, so now there's a positional patient. You put on the sitting up position, and as in a desirable position. Yeah. So now we need to pour the medication, and this is how we are going to do it. You see, you buy a few more when we are in our houses and stuff. You be a grosua, oh my, say, yeah, that's not how we do it in nursing. Yeah. So this is how we are going to do it. You will place the medication here, like this. So yeah, so we do it like this, So then afterwards, the cork of the medication will be in the hands like this. It will still be intact. Then we are going to pick our on the eye level. See, then we pour the medication. So after you are done, you still place it like this. So like this. Then you put it down. So guys, after you are done, after pouring the medication on the measuring cup, you need to also do the last check. To see say AMPA is the right medication that you are giving to the patient. Yeah, so let me do it. So guys, you give the medication to the patient, and let me remind all of you guys. Most of you see, because we have poured the medication into the measuring cup, no, that's not the right thing to do. Whether you've poured the medication on the right, on the measuring cup, you need to still make sure that the spoon is intact. We have some people who stir the medication on back before it's on so the spoon there needs to be intact, whether the patient is going to use it or not. Just okay, actual what. Yeah, so we will give the next medication. So that one too, the same procedure that we did, for opening it, the same thing on the side. So place it here, then we open it. The cork will be intact. We pick our the eye level, on the eye level. Don't let this the lips touch this lips. Then you pour it again. So afterwards, you place it. Then you lock it again. Then put it down and give it to the patient again. So afterwards, you need to give the patient water. It depends. There are some patients who wouldn't like water, but you see, we have some people who even drank tea and still be asking for water. So you need to give the patient water. That's the reason why you brought this cup. So you pour your water here. And I want to place it on the saucer. So guys, after you are done, you need to also monitor your patient for a while and also check. Maybe we have some patients who might so you need to engage the patient small to see say I don't know what normal and answer one normal. So you need to have a little convo with the patient. Sister, okay, but I say okay kaka. I'm a question what me edit kaka. So through this conversation, you will get to know. So on Madrona and our many you'll be able to know. That should be then you need to ask the patient, say if you feel okay to be in this position, or he wants you, or he or she wants you to also put her in a different position. And this is again about your position where you okay, man. Then you need to make sure that you make the patient comfortable in bed. So you need to in bed like this is again. To make call next station one. To say, oh, here be an album, I just want to. Na me ko iso se bia wo se wakoma no body tending and I will feel so be fifi ni ade a na me hu ni ntem wo se bi why normal but say about what was so persistent so na waka chere na ya mu de be ya intent at what and better to minister me baba be check provide answer. So okay, so guys, you thank your patient, then you document, then discard your things, then you wash your hands. Thank you.